Hello, my name is Kimberly Harrington. I'm a registered nurse. I am the health chair for the Southside NAACP branch. And I'm speaking today about some of the health issues in particular that are affecting the people of color community. I wouldn't just say African Americans, but any people of color, that being Hispanic Americans, Asian Americans, Indian Americans, all people of color. And we're all affected by the same health issues, and it crosses color barriers all the time. Now, I grew up in Chicago, on the south side of Chicago, so I'm very familiar with a lot of the issues that afflict our community firsthand. That being, of course, asthma, diabetes, hypertension, and on, all these other issues go on. In particular, something that has been brought to our attention as registered nurses, as that's my practicing profession, is that we have a high incident of ER usage due to respiratory issues that are not being controlled. And when the doctors and the other healthcare professionals say, well, it's not being controlled because the people are not using their rescue inhalers as need be, and they're not doing follow-up care at the doctors' clinic visits, that's not necessarily what we're finding to be true. There are some conditions that the parents or even the children, try as they may, can't control, and that being the pollutions and the toxins that are in our environment, the air quality in particular. Now, that is a big issue that I can guarantee you not a child or their parent can control. And that's what brings me to the Fisk and Crawford coal power plants. They are really in the Pilsen and the Little Village community, but that air quality or lack of quality air doesn't just stay and concentrate in Pilsen and Little Village. When the wind blows, it blows, and it'll move that the pollutants north, south, east, west. But we all know, hopefully, that wind blows on the westerly winds, and it blows downstream. And unfortunately, traditionally, historically, people who are economically disenfranchised find themselves in some of the worst areas as far as quality of air, quality of land, quality of water. And because of their inability to have the financial access, they have limited power or access to our elected officials and having their voices heard. So they're at the mercy of people like myself who are part of NAACP and other grassroots organizations and civil rights organizations to speak up on their behalf. And that's what I'm trying to do now. So when I work in the ER at respective hospitals, and I've worked at several, consistently we have a lot of emergent respiratory patients who come in. And as soon as we get them, breathing readily on their own without any kind of obstruction, those same people will be right back in. And it's not because they're not compliant. It's because it gets hot, and we have a lot of, especially in Chicago in our summertime, the air gets stagnant. And it's very humid here because we're right off the lake, Michigan. And then next thing you know, we have an influx, a barrage of people in whatever ER, basically Cook County Hospital ER, Trinity way over to the southeast side of Chicago, or even, let's see what other ERs I can think of, Christ, Little Company, there will be Mercy Hospital, let's see, University of Chicago right here to the south. There's all of these ERs are barraged with the same problem. Is usually we have to deal with the respiratory. And these people, they are just not aware of how to advocate for their rights with regards to their government and how their government is protecting their rights as far as Environmental Protection Agency is concerned. So the Environmental Protection Agency will say there's parts per million that is allowable in the air quality, and then so much of the soil is contaminated, and they're aware of it, and they'll say then we'll take a random soil sample, and then they'll come back with these arbitrary or these results, and they'll say, well, this quality of this soil is inhabitable, you're not growing any farmland or any vegetables on it, so you can live on it. And then the pipes will have like corrosion and rust. And so there's so many issues that are before the people that they don't know where to begin to tackle the problem. And so sometimes that's why they just become like, very distraught. Or, this is just where I'm left to just live with these conditions. And I would say if I was in that same predicament, and I am very grateful that I'm not, that I would be just distraught also, because if I didn't feel as though that there was any resources for me to resolve and my life quality, I would like to live as long as the Lord would allow me to live and be productive. But then you have these issues that are circumstances that you are finding yourself living in, and you don't know how to come out of it. That being, this company will say, we can build here because the government said we can, and this is the product we're going to put out in your community. And if you don't like it, you can sell us your home for pennies on the dollars and move, or you can stay here, and then your children, unbeknownst to you, unborn or born, will become subjected to these toxins, being there's like particulates, you know, when the solid matter kind of settles, and when the wind blows, it disturbs it, and it blows all back up in the air. Child outside playing inhales it, and then those particulates settle in their lung base or in their little nasal cavity. Next thing you know, they're wheezing, they can't breathe. The mother, the father, the whomever is taking care of the child at the time recognizes those symptoms. They're rushing the child to the closest ER, and that situation continues. Now, when the mother keeps going to the ER or even going to a clinic appointment to tell the doctor, this is why I was in the ER on this day for this situation, the doctor is now fussing at the mother, because I see this quite often, that telling the mother that she's not being responsible with regards to having the rescue inhaler filled or using it appropriately. They're not looking at the big picture that this mother is not controlling that air quality or the quality of the water. Those particles, they settle in your water supply. Not that we have well water here in the city of Chicago, but there is well water in other areas in the outlying suburbs, and they are also up against similar situations with regards to quality of water, quality of air, because what happens here gets into other communities too. So people can't look at it as just that it's isolated because this is where these people unfortunately have to live, or it's where they found themselves in this area where there's a lot of industry, like not just the steel mills. Those were a big problem here in the city of Chicago for a while. We had Wisconsin Steel, we had Inland Steel, we had Ryerson Steel, we had Burnside Steel, steel. Yes, steel is the strong backbone of building a lot of the skyscrapers and homes that we celebrate here in the city of Chicago, a lot of skyscrapers. But when it's all said and done, that waste material goes somewhere in the runoffs, and it gets back into your water supply, and then it has to be treated through the water reclamation district. And we have a very good quality of water here, but when it's sold to the outlying suburbs, if they don't want to pay the money that the city of Chicago is asking for, then they're at the mercy of using well water, and then it contaminates, and then the elevated ore concentration, nitric oxide. It's just so much that is in our environment that people are not aware of. And the only way to help them arm themselves is with information and educational opportunities as such. And when people are aware, when they know better, they tend to usually do better. And that's what I have learned through my experience of just living. And I was just very fortunate to have, people in my life, my mom, my dad, friends, aunts, uncles, who were just avid readers and very active in trying to make sure that they were doing the best for me and for people in our immediate community, so that we will all move ourselves forward and try to help not just our family, but help our community, and then the community helps the city, and it's just a continuum. And that's kind of like where I am with it. Education is the key to getting people better services, better quality of life.